What are some gruesome facts about pregnancy/childbirth/postpartum that not many people know? Labor does not automatically start if you lose the baby. You can try to induce, but sometimes it just takes time. You can opt for a C-section, but surgery when it doesn't affect the life of the baby is not always the best option. I was wandering around 8.5 months pregnant for 2 weeks before the induction took. Until then it was checking into the hospital, blood work, induction, contractions, then nothing. Go back home, rest a few days, try again. Fully pregnant, planning for after. Will there be a burial? Cremation? What clothes should baby wear? And of course, people still asking when I'm due and such. Even the blood work lady asked about the baby. All happy. The maternity blood person was busy, so they sent me to the regular hospital area. She wouldn't stop asking boy or girl. When's the big day? I figured vague answers while pointing to my paperwork would clue her in. It did not. She was like, "You don't seem very excited." Seriously, maybe I was a surrogate, or putting it up for adoption. Why did she assume it was all happiness and rainbows? But planning a funeral for a baby while still pregnant was awful. And the birth was difficult. It was a dry birth, of course, meaning no water in the sac, so more difficult and higher infection risk. I also broke my tailbone pushing. I don't know why, but something about that part felt extra unfair. Postpartum depression is extremely dangerous and can last for months after their birth. After my twins were born, my wife had a complete personality change. She became suicidal, and at times abusive to me. At one point she ran away from home. I found her 2 states away. Her brother had to bring her home. Things got really, really bad. The twins are 5 now and she's the person I married again. She doesn't like to talk about those times. The only thing she'll say is it was the darkest time in her entire life. First trimester miscarriages are way more common than most people think. 1 in 4 pregnancies terminate before 3 months. The thing that frightens me the most is pelvic floor issues. Imagine suddenly no longer being able to control when you pee. The feeling of your organs going back down after they were cramped up for so long is a bit frightening. Especially the lungs. Standing up I could feel like they were weighted down. People talk about cracked nipples and painful latching while discussing breastfeeding, but nobody talks about your uterus contracting during the first days of it. After birth, I sweat so much at night that I would wake up soaking wet from head to toe for the first week or 2. Nobody warned me that my insides would feel like they were falling out when I stood up the first few days after birth. Sometimes it takes /weeks to be able to stand up /sit down /walk again without a ton of pain. No one fucking told me that the first time. I was so focused on how the actual birth might be painful, had no realization that for over a month afterwards I'd be in danger of burning to death if the house ever caught fire because I could barely walk. They go full crazy pushing your stomach after birth to make sure everything is out. I read some books but no one prepared me for that. It was like having another baby. Passing clots the size of rocks. And bleeding for weeks after. My wife's placenta wouldn't detach after the birth of our daughter, so the nurse just went up in there and got it out. I was ohing and ahhing over our new baby girl and I look over to see someone damn near elbow deep treating my wife like a sock puppet. It was so jarring. Mothers are so damn tough, dude, it's unreal. Contractions don't finish after labor. You have the after-birth pains to look forward to when your uterus returns to its usual pre-pregnancy size. Postpartum mental illness is a thing, and it can be horrific. The leading cause of death in pregnant and postpartum women in the US is homicide. Currently pregnant. Have pregnancy rhinitis, which is effectively like a cold caused by being pregnant. Also have morning sickness. Have you ever had uncontrollable sneezing while blowing chunks? Not bucket list worthy, I promise. A short time before you give birth, anywhere from 1 to a few days before, you will pass a mucus plug, which is basically a giant loogie that dislodges from your cervix and falls out of your vagina. Somehow it's even grosser than you would think. When you birth your baby, you also birth the placenta. When the placenta detaches from the uterine wall, it leaves a raw gaping wound the size of a dinner plate that bleeds for weeks. Make sure you have lots of large maxi pads on hand. Everything smells like old ham for basically the entire first trimester and makes you constantly feel like you're about to vomit. It's like a hangover that lasts for weeks or months. Even things you loved the smell of before, now smell like the dirty coins from your grandpa's car's cup holder. Some lucky women have this through their whole pregnancy, along with the resulting nausea and vomiting. Your baby will come home with a huge gnarly scab attached to their belly button. My boyfriend wasn't prepared for this one. Apparently he thought that cutting the umbilical cord made it somehow detach from the baby right then and there. Nope. Big chunk of it stays behind, but will dry up over a number of days and eventually fall off. PTSD as a result of a difficult birth is surprisingly more common than you think. I still suffer symptoms even now, and my daughter is now 10. You will need to prep yourself for the second birth. What is that? It's when you have your first full bowel movement after hyperemesis gravidarum. Terrible. I lost 50 pounds during my pregnancy from it. Preeclampsia can last up to 6 weeks postpartum. You'd be amazed at how many emergency personnel don't know this. When asked if you have any medical history, please volunteer the information that you are postpartum. Don't wait for them to specifically ask. /steps off of soapbox /. The placenta is the size of a plate and leaves an internal open wound that size that also needs to heal. Edited to add, the responses and shock to this make me really angry about the level of maternal education and care that is being given. The first time you have sex after childbirth, even if it's been 6 weeks, is excruciating. ETA, for the woman. Seemed like it was taking a long time for my OBGYN to stitch up tears and an episiotomy. I whispered to my L&D nurse if it normally took this long. She whispered back, "Girl, you're torn from clit to shit. It's gonna take as long as it takes. There's a very high chance that you will poop during the birth. Pushing is pushing. If you don't poop, then it means you are in for a bigger poop afterwards. Speaking of poop, the baby will often poop on you during the skin-to-skin immediately after the birth. When you get a C-section, they may have to take the section of intestines covering your uterus out of your body. Like, it's just sitting in a bowl next to you, then once the baby's out and your uterus is stitched back up, they just pack your guts back in and sew you up. Usually it's just pushed to the side, though. Also, your uterus is pulled partially out of your abdomen so they can deliver the baby. Not gruesome, but postnatal depression is literally the worst thing I've experienced in my life. It's been 5 years since I had my last one and I'm still struggling now. No amount of help has worked from the doctors. I have no help from anyone else. I wouldn't wish this on my worst enemy. I don't even know who I am anymore. All I wanted was to meet the love of my life and be a mom. And now I look in the mirror and don't recognize myself. My body isn't mine anymore, and I can't think of a worse fate than to have another child. Don't get wrong, I love my kids, but if I knew what was coming, I wouldn't have put myself through this. You will probably be very low on iron. Iron supplements will probably make you very sick. Kellogg's cereal, such as Frosted Mini Wheats, have 100% of your daily value of iron in a serving. Put 2 measuring cups of it in a Ziploc bag and snack on them during the day. Can't believe this hasn't been mentioned: hemorrhoids. Often women don't know they have them from labor due to the swelling, but add it to the list: weary face. If you have labored to full dilation, you can still wind up with an emergency C-section, so you don't get the "at least you can sit down / your baby has a nice round head" benefits of not delivering vaginally. If your baby's head is stuck in the birth canal when they do the C-section in these circumstances, freeing it comes with a really juicy squelching pop, breaking the suction. Quite unnerving to hear. The umbilical cord is dense, tough, and sinewy. When you cut it you end up sawing a little with the scissors. I don't know what I expected, but that was weird.